Hello friends, welcome to my channel Food and Fitness. Today we are going to discuss on gout. Gout is a common and complex form of arthritis. It can be defined by sudden, severe attacks of pain, swelling, redness and tenderness in one or more joints, most often in the big toe. An attack of gout can occur suddenly. The affected joint is hot, swollen, and so tender that even the weight of the bedsheet on it may seem intolerable. What are the symptoms of gout? Intense joint pain. Gout usually affects the big toe, but it can occur in any joint. Other commonly affected joints include the ankles, knees, elbows, wrists, and fingers. The pain is likely to be the most severe within the first 4 to 12 hours after it begins. The affected joint or joints become swollen, tender, warm, and red. After the most severe pain subsides, some joint discomfort may last from a few days to a few weeks. As gout progresses, you may not be able to move your joints normally. What are the causes behind gout? Gout occurs when urate crystals accumulate in your joint, causing the inflammation and intense pain of gout attack. Urate crystals can form when you have high levels of uric acid in your blood. Your body produces uric acid when it breaks down urine substances that are found naturally in your body. Normally, uric acid dissolves in your blood and passes through your kidneys into your urine. But sometimes either your body produces too much uric acid or your kidneys excretes too little uric acid. When this happens, uric acid can build up, forming sharp, needle-like urate crystals in a joint or surrounding tissue that cause pain, inflammation and swelling. Who are at high risk to develop gout? You are more likely to develop gout if you have high levels of uric acid in your body. Factors that increase the uric acid level in your body include diet. Eating a diet rich in red meat and shellfish and drinking beverages sweetened with fruit sugar increase levels of uric acid, which increase your risk of gout. Alcohol consumption, especially of beer, also increases the risk of gout. Weight. If you are overweight, your body produces more uric acid and your kidneys have a more difficult time eliminating uric acid. Certain diseases and conditions increase your risk of gout. These include untreated high blood pressure and chronic conditions such as diabetes, obesity, metabolic syndrome, and heart and kidney disease. Low dose aspirin and some medications used to control hypertension and beta blockers also can increase uric acid levels. If other members of your family have had gout, you are more likely to develop the disease. Gout occurs more often in men, primarily because women tend to have lower uric acid levels. After menopause, however, women's uric acid levels approach those of men. Experiencing recent surgery or trauma can sometimes trigger a gout attack. In some people, receiving a vaccination can trigger a gout flare. What are the do's and don'ts on gout? Being overweight increases the risk of developing gout and losing weight lowers the risk of gout. Eat more fruits, vegetables and whole grains which provide complex carbohydrates. Avoid foods and beverages with high fructose corn syrup and limit consumption of naturally sweet fruit juices. Stay well hydrated by drinking water. Cut back on saturated fats from red meat, fatty poultry, and high fat dairy products. Focus on lean meat and poultry, low fat dairy, and lentils as sources of protein. Avoid organ and granular meats such as liver, kidney, and pancreas, known as sweetbreads, which have high purine levels and contribute to high blood levels of uric acid. Limit serving sizes of beef, lamb, and pork. Some types of seafood, such as shellfish like shrimp, lobster, mussels, anchovies, sardines, and tuna, are higher in purines than other types. Beer is associated with an increased risk of gout and recurring attack. Limit or avoid sugar sweetened foods such as sweetened cereals, bakery goods, and candies. Limit consumptions of naturally sweet fruit juices. Vitamin C may help lower uric acid levels. Consume vitamin C enriched food every day like gooseberry, lemon, etc. Some research suggests that drinking coffee in moderation, especially regular caffeinated coffee, may be associated with a reduced risk of gout. There is some evidence that eating cherries is associated with a reduced risk of gout attacks. Do not consume high fructose products like soda and some juices, ice cream, candy, and any kind of fast food. What are the best foods for a gout diet? Low fat and non-dairy fat products such as yogurt and skim milk, fresh fruits and vegetables. Consume moderately nuts, peanut butter, and grains. Potatoes, rice, bread, and pasta. Moderately consume eggs. Consume meats like fish, chicken moderately. You may see veggies like spinach and asparagus on high purine list, but studies show they don't rise your risk of gout or gout attacks. So maintain the do's and don'ts on gouts. Always stay healthy and happy and think positively. If you enjoyed the video, leave a like, share the video with your friends, subscribe now and press the bell icon to get the latest notification. Thanks for watching the video.